Ever pondered about the complications of hypertensive drugs? Hypertension or high blood pressure is a common condition managed by a group of medications known as hypertensive drugs. These miracle workers in pill form play a vital role in controlling blood pressure levels, reducing the risk of serious complications like heart disease and stroke. But as with most things in life, there's a flip side. While these medications are undeniably beneficial, they can also come with a set of potential side effects and complications. Some people might experience symptoms ranging from mild discomfort to more serious health concerns. However, it's important to remember that not everyone will experience these complications, and for many, the benefits of controlling hypertension far outweigh the risks. So, are you curious about what these potential complications might be? Want to learn more about what to look out for when taking these medications? Stay tuned as we delve into the potential complications of hypertensive drugs. First off, let's tackle hypotension and electrolyte imbalance. Hypotension, or low blood pressure, is a potential complication of antihypertensive medications. It's a bit of an irony, isn't it? Medications designed to lower high blood pressure can sometimes do their job too well, causing your blood pressure to drop lower than desired. This may lead to symptoms such as dizziness, fainting, or weakness. The risk of hypotension is especially high if the dosage of the medication is too high, or if it's taken in combination with other blood pressure-lowering drugs. Now let's talk about electrolyte imbalance. You might remember from your biology class that electrolytes are minerals in your body with an electric charge. They play a crucial role in a range of essential bodily functions, including maintaining water balance, muscle contractions, and heart rhythm. Certain antihypertensive drugs, especially diuretics, can affect the balance of these electrolytes. Diuretics work by increasing urine output to help lower blood pressure, but in the process, they can also flush out electrolytes like potassium and sodium from your body. Losing too much of these electrolytes can lead to muscle weakness, cramps, or even irregular heartbeats. It's like playing a game of Jenga with your body's delicate balance. If one block is removed, it could cause the entire tower to tumble. It's also worth noting that electrolyte imbalance isn't just about losing too much. In some cases, the body might retain too much of a particular electrolyte, which can also be problematic. For instance, excessive potassium in the body, a condition known as hyperkalemia, can also lead to irregular heartbeats and other issues. So, how do we avoid these complications? The key lies in regular monitoring and communication with your healthcare provider. Regular blood tests can help keep track of your electrolyte levels and blood pressure, allowing for adjustments in medication or dosage if needed. In conclusion, while antihypertensive drugs are effective in managing high blood pressure, they can sometimes lead to complications like hypotension and electrolyte imbalance. But with regular monitoring and open communication with your healthcare provider, these risks can be managed effectively. Now, on to some complications that affect the body's vital organs. Did you know that hypertensive drugs could potentially affect your kidneys and sexual health? Take a moment to consider this. Certain hypertensive medications, especially those that act on the renin-angiotensin-aldosterone system, can impact kidney function. This is why regular monitoring of kidney function is often advised for individuals on these medications. But it doesn't end there. Some antihypertensives, specifically beta blockers and diuretics, could contribute to sexual dysfunction. This could manifest as erectile dysfunction or a decrease in libido. It's important to remember that not everyone will experience these side effects, and the benefits of these medications in controlling blood pressure usually outweigh any potential risks. However, if you notice any changes or discomfort, don't hesitate to discuss it with your healthcare provider. The key is to maintain open communication and regular checkups. Now let's look at some other possible side effects. Moving on, we have cough, metabolic effects, orthostatic hypotension, and allergic reactions. Let's talk about cough and respiratory issues first. Certain antihypertensive drugs, notably angiotensin-converting enzyme or ACE inhibitors, might cause a persistent dry cough. This occurs because these drugs can increase levels of bradykinin, a peptide that can cause inflammation and irritation in the lungs. If a bothersome cough develops, a healthcare provider might switch the patient to a different type of antihypertensive medication. Now, let's delve into the metabolic effects. Some antihypertensive medications, particularly beta blockers and thiazide diuretics, can affect your metabolism. This could lead to changes in blood glucose levels and lipid profiles, potentially affecting individuals with diabetes or those at risk of developing diabetes. It's crucial to monitor these levels regularly if you're on these types of medication. Next up is orthostatic hypotension. This is a sudden drop in blood pressure that happens when standing up from a sitting or lying position. It can cause dizziness or, in severe cases, fainting. Certain antihypertensive drugs can cause this, especially when starting a new medication or increasing the dosage. It's essential to rise slowly from a sitting or lying position if you're on these medications. Lastly, let's discuss allergic reactions. While rare, some individuals may have an allergic response to certain antihypertensive drugs. This could lead to symptoms like skin rashes, itching, or swelling. If you notice any of these signs after starting a new medication, it's crucial to seek immediate medical attention. As we've seen, the potential complications of hypertensive drugs can be varied and complex. It's important to remember that these side effects are not inevitable, and many people use these medications without any issues. However, being aware of these potential complications and communicating any concerns with your healthcare provider can ensure the best possible outcome in managing hypertension. So, what can we do to manage these potential complications? The answer lies in regular and open communication with your healthcare providers. Establishing a routine of frequent check-ins allows them to monitor your condition and adjust your medication or dosage as needed. It's crucial to report any symptoms or side effects you're experiencing promptly. This is not the time to be shy or stoic. If you're feeling dizzy, having cramps, or noticing changes in your sexual desire, let your healthcare provider know. These might be signs that your body is reacting to the medication, and adjustments might be necessary. Remember, hypertensive drugs are a tool to manage high blood pressure. Like any tool, they must be used correctly to be effective and safe. That's where your healthcare provider comes in. They're your guide on this journey towards better health. Always remember, your health and well-being are paramount. Stay informed, stay safe. And that wraps up our discussion on the potential complications of hypertensive drugs. Remember, these medications are crucial for managing hypertension, but any side effects should be promptly reported. Regular communication with healthcare providers is key. Don't forget to subscribe for more informative content like this. Thank you for watching.